Right now, swallow once, just once, and pay attention to the back of your throat. Is there something sitting there? A thickness, a coating that won't clear no matter how many times you clear your throat this morning. Here's the question that matters. If I asked you exactly when this started, could you answer me? Most people can't. It crept in slowly. Mornings first, then all day. And now it's just part of getting up in the morning. You carry water everywhere. You've cut out certain foods. You've tried everything a neighbor or a cousin has ever suggested. And you're still here, still clearing your throat. Here's what I need you to really hear. That mucus is not random. Your body doesn't produce a symptom for no reason. Every persistent symptom is a message, and today we're going to learn how to read this one. In years of working with older adults on preventive health, this is one of the most misunderstood symptoms I see. People get handed lozenges. They're told to drink more water and move on. And the real cause sitting underneath it all is never actually addressed. Today that changes. We're going to walk through 5 research-informed causes of persistent throat mucus in adults over 55, and I'm going to show you how 2 of them tend to show up together, quietly making each other worse. Before we go further, tell me one thing in the comments. Is your throat mucus worse first thing in the morning, or does it stay with you all day? Write morning or all day. Your answer actually tells us a lot about what's driving this. Let's start with something almost nobody explains clearly. Your body makes mucus every single day, around the clock, and that is completely normal. Mucus is protective. It traps bacteria, dust, and viruses before they reach your lungs, and it keeps the delicate lining of your throat from drying out and cracking. Mucus itself isn't the enemy here. What changes is how efficiently your body clears it. Your airways are lined with microscopic hair-like structures called cilia, and their job is to sweep mucus up and out continuously, thousands of times a day, without you ever noticing. In a younger adult, that sweeping system works quickly and quietly. As we age, though, cilia naturally slow down. Mucus that would have cleared in seconds at 40 can sit and pool for hours later in life. That single fact changes how you should think about everything else in this video. Any factor that pushes your body toward extra mucus is going to hit harder and last longer than it would have a few decades ago. That's not a flaw. It's simply physiology, and understanding it is the foundation for everything we cover next. The first cause is, in my experience, the most frequently missed explanation for this exact symptom. It's called laryngopharyngeal reflux. Most people just call it silent reflux. You probably know classic heartburn tar, that burning sensation after a heavy meal. Silent reflux is quieter and more deceptive. No burning, no obvious digestive discomfort, just a throat that won't settle. Here's the mechanism. Where your esophagus meets your stomach, there's a muscular valve whose only job is staying closed after you eat, keeping acid where it belongs. As we age, that valve can lose some of its tone, the way a rubber band loses its snap after years of use. When it doesn't close fully, acid can travel upward, not just into the esophagus, but into the throat, the voice box, sometimes even the nasal passages. And your throat tissue was never built to tolerate acid the way your esophagus is. Even a small amount reaching your throat triggers a protective response. Your body produces thick mucus to coat and shield the irritated tissue. It's logical biology. But when this happens quietly, night after night while you sleep, you wake up to that same heaviness with no obvious explanation. Clinicians who treat this condition regularly will tell you something important. A large share of people with silent reflux never experience classic heartburn at all. Just morning throat clearing, a rougher voice on waking, and mucus that seems to start the moment they open their eyes. I think about a patient story that's common in this space. Someone in their 60s who spent 2 years assuming their throat trouble was just allergies, tried every lozenge and spray on the pharmacy shelf, and never once considered their stomach. Once silent reflux was addressed with simple evening habits, the improvement took only a few weeks. Ask yourself honestly, is your throat noticeably worse in the morning than later in the day? Does it worsen when you bend forward? Has your voice sounded rougher right after waking? These are the fingerprints of silent reflux, and we'll cover exactly what to do about it in the action plan. One more thing worth your attention. If you regularly take anti-inflammatory medications for joint pain, ibuprofen or naproxen, for example, these can reduce your stomach's natural protective lining, which can make acid reflux, including the silent kind, more likely. If that applies to you, it's worth mentioning to your doctor. Before we continue, tell me your name and where you're watching from. I read the comments, and I genuinely want to know who I'm talking to. The second cause tends to arrive quietly, and that's exactly why it goes unnoticed. When people picture sinus problems, they picture the dramatic version: facial pressure, a throbbing forehead, a nose that's completely blocked. But in many adults over 55, chronic sinus inflammation shows up almost invisibly. Breathing feels mostly fine. There's no dramatic headache. And yet the sinuses, mildly inflamed and producing slightly more mucus than usual, are draining steadily down the back of the throat, all day long. This is post-nasal drip, and it shows up especially often in this age group, which is one reason it's so easy to dismiss as just getting older. Here's the frustrating part. Many people in this situation have been taking over-the-counter antihistamines for months, assuming it must be seasonal allergies. Antihistamines dry mucus temporarily, but they don't touch the underlying sinus inflammation causing the extra production. And dried, thickened mucus at the back of the throat is often more uncomfortable than the original problem. The approach with the strongest, most consistent support is simple and inexpensive. Regular nasal rinsing with a warm saline solution. Nasal irrigation is one of the most well-studied, low-cost tools for sinus and nasal health, and ENT specialists commonly recommend it as part of a broader treatment plan. High-volume saline rinses physically flush out inflammatory mucus, calm the swelling in the nasal lining, and support the same ciliary clearance system we talked about earlier, the very system that slows with age. The single most important word here is consistency. 1 or 2 uses gives you 1 or 2 days of relief. Daily use, done correctly, produces real cumulative improvement over a couple of weeks. If this is helping so far, type 2 in the comments so I know you're still with me. And if you haven't subscribed, this channel exists to keep giving you plain language health information like this, so consider joining us. If this video is helping you make sense of something you've been living with for a while, a quick like helps more people find it. Now let's keep going, because the next cause surprises almost everyone I share it with. Because number 3 is the one that produces the most surprised expressions when I bring it up. Because the medications people take faithfully, sometimes for years, are simply not something they think to question. There's a class of blood pressure medications called ACE inhibitors, angiotensin-converting enzyme inhibitors. They're prescribed extremely often, they're effective, and they serve an important purpose. But this class of drug carries a well-documented side effect. It allows a substance called bradykinin to build up in the body and in a meaningful share of users, commonly cited in the range of 5 to 20% dose. That buildup triggers persistent throat irritation and an ongoing urge to clear the throat. This is not an allergy. It's simply a known mechanical effect of how the medication works, and some people's throats are more sensitive to it than others. Here's the detail that causes this connection to be missed constantly. This side effect can take weeks, sometimes months, to develop after starting the medication. If you started a blood pressure pill 8 months ago and your throat started bothering you 6 months ago, you may never have connected the two events, but that delayed pattern is exactly what research on this side effect describes. Older adults appear to experience this particular side effect more often than younger patients, which makes it especially relevant for this audience. If you take a blood pressure medication and you're not sure whether it belongs to this class, your pharmacist can tell you in under a minute. And if it does, there are alternative categories. ARBs, angiotensin receptor blockers, ARs, that manage blood pressure equally well without this particular side effect. That's a conversation worth having with your prescribing doctor, not something to change on your own. If you're still with me, type clarity in the comments because that's exactly what today is meant to give you. The fourth cause surprises people for the opposite reason, not because it's complicated, but because they dismissed it as too obvious to matter. Hydration. Let me give you the actual physiology because it's more specific than drink more water. Mucus is mostly water, and its consistency, thin and easy to clear or thick and sticky, depends directly on how hydrated the surrounding tissue is. Think about maple syrup fresh from the bottle versus syrup that's been left open overnight. Same substance, completely different behavior. Your mucus responds to hydration in exactly that way. Here's the aging-specific detail that matters. Your thirst mechanism becomes noticeably less reliable as you get older. A younger adult feels thirsty well before they're meaningfully dehydrated. In older adults, that early warning system is blunted, which means you can be dehydrated enough to affect your mucus and your daily comfort without ever feeling particularly thirsty. Waiting for thirst means you're already behind. A commonly used guideline in clinical nutrition is roughly 30 milliliters per kilogram of body weight per day from all sources. Water, herbal tea, soup, and water-rich foods all count. The behavioral key is deliberate, spaced intake throughout the day, not catching up all at once when you remember. If this is landing for you, type 4 in the comments. And if you haven't hit subscribe yet, the bell notification means you won't miss what's coming next. The fifth cause almost never gets discussed in videos like this one, and for a meaningful number of people, it's actually the root of the problem. It isn't in the throat, the sinuses, or the stomach. It's in the gut. Your digestive tract and your respiratory system share regulatory pathways through the immune system, sometimes called the gut-lung axis. The state of your gut microbiome, the trillions of bacteria living in your intestines, can influence how reactive and inflamed your upper airways are. When that microbial balance is disrupted, a state researchers call dysbiosis, it can activate immune responses that contribute to extra mucus production in the airways. Not because anything is physically wrong with your throat, but because your gut is sending inflammatory signals your respiratory system is responding to. This connection is an active and growing area of research. Early animal studies have found links between changes in the gut microbiome and changes in airway inflammation, though the science in this specific area is still developing and shouldn't be overstated. What disrupts the gut microbiome in older adults tends to be very ordinary things: a diet low in fiber and fermented foods, repeated courses of antibiotics over the years, high sugar intake, and chronic stress. Nothing exotic there. That's the daily reality for a large share of people. You won't fix a gut-airway connection with a throat lozenge, but you can support it steadily with daily choices. And I'll give you a concrete starting point in the action plan. Before the action plan, something genuinely important. Most of the time, persistent throat mucus in older adults is exactly what we've discussed today: manageable and not dangerous. But please see your doctor promptly, not later, if you notice any of the following: mucus that's tinged with blood, even a small amount; difficulty swallowing that's gradually getting worse; unexplained weight loss alongside your throat symptoms; a lump or persistent swelling in your neck; or a voice change that isn't improving over time. These signs go beyond what we're covering today. Please don't work around them. Bring them to your doctor. Here's what you can actually do, starting tonight. Stop eating at least 3 hours before you lie down. When you eat and recline right after, your stomach is still working, and the valve we discussed has its hardest time staying closed. 3 hours of upright time is one of the most consistently recommended steps for reducing nighttime silent reflux. Elevate the head of your bed slightly. Not extra pillows under your head, which just bends your neck, but a firm wedge under the mattress or headboard legs. Even a small incline uses gravity to reduce how much acid can travel toward your throat overnight. Drink a full glass of warm water before bed tonight. It supports overnight hydration and helps keep mucus thinner, so morning accumulation is less severe. Tomorrow morning, before coffee, before breakfast, drink 1 to 2 glasses of plain warm water. This single habit costs nothing, and it begins loosening overnight mucus before it becomes your whole morning. This week, get a nasal rinsing device from the pharmacy, a neti pot or a squeeze bottle. Use water that's been boiled and cooled, never straight tap water, with a small pinch of plain salt, and optionally a very small pinch of baking soda. Use it once daily, ideally in the morning, and give it 2 full weeks before judging whether it's helping. Consistency is what separates people who say it worked from people who say it didn't. Book an appointment specifically to review your medication list against your throat symptoms. Bring a written timeline, when your throat symptoms started and when you started or changed any medication. If you take a blood pressure medication, ask directly whether it's an ACE inhibitor and whether an ARB alternative might make sense for you. To support your gut-airway connection, add 1 small daily serving of a fermented food, plain yogurt with live cultures, kefir, a small portion of kimchi or sauerkraut. This is a long-term strategy, not an overnight fix, but long-term strategies are the ones that actually change your baseline. Set hydration reminders, keep water accessible in every room you spend time in, and add water-rich foods, cucumber, watermelon, soups, herbal teas, into your day. A quick word on the home remedies you've probably already tried. Honey is genuinely soothing for irritated throat tissue and can calm symptoms temporarily, though it doesn't address any of the 5 causes we covered. Dairy doesn't create mucus out of nothing. The science doesn't support that idea, but some people notice dairy proteins seem to thicken existing mucus. If you notice a consistent pattern, a 2 to 3 week reduction trial is a reasonable thing to try. Apple cider vinegar is a popular suggestion online, but if you have silent reflux, adding more acid to the system can make things worse. Worth being cautious there. Here's what I want you to walk away with today. That persistent mucus at the back of your throat has a reason, likely one of 5 reasons we covered, and most people living with this have never had a single one explained properly. Silent reflux happening quietly while you sleep, with no heartburn to warn you. Post-nasal drip from low-level sinus inflammation that never announces itself dramatically. Medication-related irritation from ACE inhibitors, developing months after starting a prescription and rarely connected to the throat. Mild chronic dehydration, running just below the level that triggers obvious thirst. And a gut-airway connection quietly influencing inflammation in ways researchers are still working to fully understand. None of these require you to just accept a life of constant throat clearing. Each one has a practical, sensible response, and none of the first steps require a prescription. If someone ever told you this is just what getting older feels like, I hope today gave you a different way to look at it, because you're not just aging. You're dealing with specific, identifiable physiology, and you deserve to know that. I'm Dr. Josephine, and this channel exists for exactly this practical, honest health information for the years ahead. If this video gave you something useful, share it with one person who's been quietly dealing with the same thing. And tell me in the comments, which of these 5 surprised you the most, and how long have you been dealing with this? Take care of yourself.